Welcome to the Menopause Stories Podcast. I'm your host, Dr. Tamara Beckford, founder and medical director of Truly Balanced Wellness Care. This is the space where we stop the guesswork and start the optimization. We're pulling back the curtain on that midlife hijack and giving high achieving women the clinical roadmaps and unfiltered stories they need to reclaim their edge. Let's get into today's story. Welcome to the Menopause Stories Podcast. I'm Dr. Tamara Beckford with Truly Balanced Wellness Care. I'm here with a friend. Yes, I bring my friends on to share their stories with you. This is Dr. Esra Shermadou. We are going to dive into her story, which some of you will relate. I know there's such a varied amount of portion and topic when we think about how menopause affects us. And there are those of you who have gone through menopause at an earlier age than the stated 51, 52. And today's story is about just that. Alrighty, Dr. Esra, my friend, it's so great to see you. Thank you for stopping by. So give us a little bit of intro about who you are, what it is that you do, and tell us about your story.
Well, first of all, thank you so much for having me. I'm excited to be here and share my story. So thank you. Yeah, so my name is Dr. Esra Shermadou, and I am a board certified family medicine and obesity medicine physician. And I am the founder of Sakina Health, which is a practice I recently opened here in Dayton, Ohio, where I focus on hormone optimization, weight management, and helping adults build sustainable lifestyle changes. And a big part of my history and my journey with cancer is kind of what led me to what I'm doing today and my path here. So I was diagnosed with cancer when I was 21, and because of the chemotherapy and stem cell transplant, I developed premature ovarian insufficiency. And so, for those of you who are not aware, that is when you lose ovarian function before the age of 40. And I was 21, so quite young. And at the time, at that time in medicine, it was different. There wasn't a lot of the support that there might be today as far as with just treating the whole body mentally, physically, physiologically with hormone replacement and the tox. But I was essentially placed on birth control pills and told I just needed to be on them, but wasn't really told why.
What
Shortly,
were you at that, like in like your journey? Like, were you in college? Were you in med school?
Mhm.
Like, what stage were
Yeah.
you, like, career wise, would you say?
Yeah, so it was my sophomore year when I was diagnosed and
Mm-hmm.
went through treatment throughout sophomore year. And I had to take time off, obviously, for these. I went through almost a year of chemo, and then had the stem cell transplant. And so I had to take a year off of, or not, sorry, a year, but a quarter off of college at that time because I was in the hospital.
Mm-hmm.
And so at that time, honestly, my focus was like, I knew that I was wanted to go into medicine, but I needed to take the MCAT, and like the MCAT kept getting delayed because my treatment kept getting delayed. And
Oh
so
no.
honestly, that was like my focus was like, I need to get this thing like over and done with. I need to get back. Like I'm behind, like everybody's ahead of me. And that was honestly like my focus. So like the thought of focusing on like my hormones and
Mm-hmm.
fertility, like that was not that was
That was
not a
like not
thought.
even like, oh my gosh.
That was like, no, I was like, I need to finish school. I need to get into med school. Like I'm right behind. And so I was at.
How did you feel that day, if you can remember, when
Mhm,
you were told, like, okay, your ovaries are no longer functioning? Do you remember that day and like
mhm.
how you felt when you heard that?
Yeah.
Like,
To be honest, it wasn't like a monumental thing. Like it was just like
mhm.
I was told that after my treatments, like it may take a while for my cycles to come back. So I was just like waited several months later, and then finally brought it up to my doctor. I was like, "Hey, like, should I be getting my cycles back?" And she's like, "Oh, they haven't." I'm like, "No." So at
Oh,
that point,
wow.
they sent me to a reproductive endocrinologist, and
Mhm.
um, I was evaluated there, and we did lots of like blood work and checked different hormone levels and like AMH and everything, and everything was quite low. And so he did try a couple things to try to like stimulate ovarian function again, but at the time like it
Mhm.
was not working. And so I was essentially just told, just you need to be on birth control pills until you're
Mhm.
about 51, and like that was that. And at that time,
It's
I
like
think
30 years. Like, hey, you gotta be a birth control pill for the next 30 years.
Yeah, and I was just like, okay, like I was like living at doctor's offices, like in
Mhm.
between school and stuff like that. And I was like, all right, moving on.
Oh.
And then I was in so at that time I had just started med school. And
Mhm.
so I remember being in my like apartment at that time, and he just called me because he knew I was in med school and I wasn't in town. And
Mhm.
so we just kind of had that conversation, and never honestly, like, I was not reflecting. I was just moving on, like, as much
Yes.
as I could. I was just powering through. And, when you get into med school, you're busy. Like, there's no time for doctors. And when I would come home, it would be during holiday seasons or weekends. And so everything is closed. So, to be honest, I was not very good with my post cancer care as far as follow up. But I mean, I
Mhm.
went for like several months. And
Mhm.
so, but yeah, and then I don't have time to go to the doctor, so I would be off and on birth control pills like many years through
Wow.
residency. Like
Mhm.
I didn't have time to go to the doctor, and then I would go every once in a while
Mhm.
to like every couple of years. I was like, I mean, maybe I should be on birth control pills again. But honestly, I just didn't know why. Like nobody really explained
Yes.
to me why they were important, and I knew that strength training was going to be important. I knew I was at
Mhm.
risk for osteoporosis, and so
Mhm.
at that point, I started strength training. Honestly, I was just working out in my apartment doing like home videos.
Mhm.
And that's kind of where that started, because before my cancer journey, I never worked out
Oh, really?
ever. Yeah, so that started during my cancer journey. So
Mhm.
yeah, and then it wasn't until my last year of med school that I started going to the gym physically. But yeah, and so that's kind of why I started. It was because just I knew I was at risk out for osteoporosis. And then when I was in med school, we learned about the WHI study
Mhm.
and how like bad hormones were. And so I was like, I don't want to be on these things
Yeah,
anyways.
so
Like,
for those
so
who are listening and they have no idea what's this WHI study, give them
yes,
a little overview of what that
yes.
study talked about and how it affected you, as you were telling us, emotionally with the
Hmm.
decisions that you were making at that time.
Yes. So the WHI study was a very large study done in the US in the late 1990s, early 2000s, where it studied really different things, but one of the things that they studied was the effect that hormone replacement had on women, and like its
Mhm.
effects on different cancers, heart disease, osteoporosis. And from that study, there was misinterpretation of the data, and it was quickly misinterpreted where there was a concern for risk of breast cancer. And
Right.
from that, there was like a lot of media around it, and essentially hormone therapy use plummeted.
Mhm.
Doctors stopped prescribing it and essentially stopped teaching it in, medical schools and residencies. And when I was going through med school and residency, it wasn't it wasn't a thing. It was just like, okay, we know that it's bad, and so we really don't want, if they absolutely have to be on it for the very, very shortest time, lowest dose, and moving on. And
Right.
so when I heard that, I was just like, well, why am I taking these things? And so I just stopped taking them. And that was kind of a reason why also, like, I wasn't like motivated to go to the doctor to get birth control pills.
Mhm.
And yeah, and so I did a lot of lifestyle things, which for everybody is important regardless. And so that was kind of the way I managed it. And then I always kind of went back and forth just trying to learn about the data around premature ovarian insufficiency. And because I was always curious, like, am I being treated appropriately? Am I not?
Mhm.
And I always felt like what I found on like ACOG and different resources was the year of publication was like old. And so I was like, I don't know, is
Like,
this
is there
updated?
an
It's never updated. And so I never found anything that was very updated. And it wasn't
Mhm.
until maybe 2 years ago when I came across a course where she actually touched on premature ovarian insufficiency specifically. And so I was like, oh, and so honestly, I took the course just selfishly to learn about my condition and what I need to be treated on and why I needed to be on hormone therapy. And that's kind of what's kind of like really turned my attention into women's health. And from
Mhm.
there, I was fascinated by hormones and their role on women's health and
Absolutely.
longevity and, cardiovascular risk and dementia and so many things. And so that's kind of what stimulated me to just delve into it. And I became very passionate about it. And
Mhm.
just, honestly, just educating women on women's health issues and just knowing the role that hormones have on our body every day and in the long term. It's so important. Like, Whether or not you want to be on hormone therapy is your own decision, but make it based on information and educate yourself, because that's the most important thing. Because you don't want to come like 20 years later and be like, oh, dang it, like I wish I would have. You
Right.
don't want to regret that. So if we can educate women, that's just a big thing that I'm very passionate about. And so, but yeah, I was taking that course selfishly for my own reasons, and then it just
It worked out.
plummeted. Yeah,
Yeah.
exactly. And here I am with my own practice, and
And now being able to support. So I have a couple of questions. You
yeah.
great. There are a couple of things that you touched upon, which I think is really important for
Hmm.
us. One is for a recap for those who are just coming in, is that Dr. Ezra was diagnosed with cancer in her early 20s. She was roughly around 21. She
Hmm.
was in undergrad, and as a result, she had chemo, you had a transplant, a bone marrow,
Stem
yeah,
cell transplant. Yep.
stem cell transplant, and the result of that was affecting her ovaries. So her ovaries don't produce the hormones
Mhm.
at the rate and so on as it should. Premature ovarian insufficiency is the medical term for that. As a result, because she's not getting the hormones, she was given the prescription, not as much
Mhm.
as education, but the
Yes.
prescription to say, hey,
Mhm.
take these birth control pills, because at the time, a lot of the hormone therapy, the menopausal hormone therapy that we are now starting to talk about a little bit more in depth,
Mm.
it was not talked about as much. And also the study came out where it was like, oh, it's going to cause cancer. You can imagine someone now, you're still in your 20s, you just battled cancer,
Yes.
and you're trying to make the decisions the best that you can. You're like, okay, you were given this prescription, take this hormone, which is like the birth
Mhm.
control pill, and you've been on and off of it because you're like, once the big study comes out saying, hey, you can get this type of cancer, that type of cancer,
Yes.
every type of cancer,
Yes.
and you just finished battling this. This is like, you battled for
Mhm.
your life a few years ago.
Mhm.
What was going through your mind at that time?
To be honest, it was, I think, there was like different stages, and I was so busy with school and residency that there
Mhm,
wasn't, I didn't focus on, outside of like
mhm,
exercising, eating healthy, I really didn't focus on very much. And,
mhm,
but there were times that it was just a little frustrating, like, cause
mhm,
I would really want to try to like do my best and take care of myself. And I
mhm,
would, I would talk to a couple of my attendings, and they would be on, like, my OB-GYN attendings, and they would be honest. They'd be like, like, I really don't know. Like, I'll be honest, like, I can send you to an REI, but I don't know. And so, and then I
mhm.
appreciate that. I appreciate the honesty. Like, at least they
Absolutely.
weren't like completely like closed off, like, no, absolutely not. Do not do this.
Mhm.
And, but at the time, honestly, my focus was on getting
School.
through residency, like
Yeah.
in med school, like that was it. And,
Mhm,
I did try, so based on like the guidelines,
mhm,
ACOG, like I did try estradiol and prometrium one time. It was
mhm,
my intern year. And, so I went, at that time, I was taking my birth control pills. And for those of you who don't know, so the hormone level in birth control pills, which is a synthetic hormone, so it's a
mhm,
little bit different in from the hormones that our body naturally makes in our body, and the levels are very, very high, especially when you compare them to the levels that are found in estradiol and prometrium, which are the more common kinds that we use for hormone replacement therapy today, or menopausal hormone therapy today.
mhm,
And so I went from really, really, really high levels to, lower levels. And I'm pretty sure I was on the 2 milligrams of estradiol and
mhm,
200 approach. To be honest, I don't know, but I did try it. But from when did that, I developed hot flashes like crazy.
mhm,
I gained weight, like, the shift in the body fat. Oh my goodness. Like, and I was trying
mhm.
to go through, and I was eating healthy. I was exercising, and I was like, what is going on with me? I just remember like those days were so, I was like, I would be like crying. Like, it was just, I was a mess. Like, and
Emotional
I would like go
mess.
to like I went to like, when I was like, what is going on? Like, I was like, and so from there, like, I stopped taking them. And I was
Mhm.
like, "Oh, well, I'm just done with hormones, like, completely." So
So you had gone from the birth control pills to the
mhm.
bioidentical hormones.
Correct,
And
yes.
then for those who are trying to follow along, like, wow, what just happened? So the birth control pills, the hormone levels, even like two things. One, it's a
Mhm,
synthetic hormone. And two, the levels in your system is higher.
mhm.
So you're going from the synthetic at a higher level naturally, where you're to a level now where you're doing the bioidentical, which is similar to what your body produces
Mhm.
and at a lower level.
Yes.
So your body is like, what did she just
Where
do
the
to me?
hormone yes.
Where are my hormones? You
Yes,
know?
yes.
And so that's what so was that your first time having or developing these what we call now
Mhm.
the menopausal symptoms? Like you said, the hot
Yes.
flash, the mood change, the weight gain.
Yes,
Yeah.
yes, yes, and it's hard to say, like, there's a lot of anxiety and stuff that go and stress, that goes into med school, so it's hard to say, like, was that, what is that
Yeah.
from? It's hard to say, but, like, as
Mhm.
far as, like, the hot flashes, the weight gain, oh, yes, absolutely, like, and
Wow.
it was miserable. It was such a difficult time, like, and then you're trying to just go on with, like, life and residency, and so I
Mhm.
remember that was, like, a very difficult time, like, just personally, and so then at that point, I was like, "Nope, I'm done with hormones, like, forget that," like, and it took a while for me to figure out, like,
But
what
isn't it
works for me.
interesting? You said I'm done with hormones, but you were you considering your birth control hormones at the
No.
time? They are hormones, but you didn't
Right,
consider.
yeah, and it wasn't until I took, like, this course, like, a couple years ago that I realized that the hormone levels are different and that, from synthetic to bioidentical, like, so it's like, now I'm like, "Oh,
That makes
that's
sense.
why."
Absolutely. Now, one other thing I want to touch on, which is so important, is something
Mhm.
that is very near and dear to your heart, which is a lot of lifestyle um,
Yes.
treatment. Yeah, ever since I've known Dr. Ezra is a power lifter. You got this episode is brought to you by Truly Balanced Wellness Care. Most high level women are told that their lives are normal while they're struggling to lead through brain fog and fatigue. At Truly Balanced, we don't settle for not sick. We architect for peak performance. Whether you need a 30-minute hormone strategy session to audit your labs or are ready for our 3-month Jumpstart Intensive, we provide the physician led roadmap to get you back to your best. Visit the link in the show notes or go to www.trulybalancedwc.com to secure your spot. Now, back to the conversation. Like
Yes.
lifts weight. And I know you mentioned that one, you started to get into that right after your
Mhm.
cancer journey,
Yep.
but this is also a very, very big part of who you are, what you do. And so what are some of the lifestyle changes that you made that you notice is making a difference for you? And and for those who are listening who are like, I want to do lifestyle too. I would love, like, what is it that I can tell my patients who
Mhm.
I love so dearly when they're like,
Yes.
I want to do lifestyle. And I'm like, all right, well, Dr. Ezra, this is how she's doing it. Give me.
Yes, yeah, so, after my journey, that's kind of when I really started to focus on, like, nutrition. I never really ate out very much before that, like, my mom's an awesome cook, and so we mostly ate at home, but I really, like, delved into making sure I was eating, like, healthily and not eating out, and, the exercising was a big part of it. So initially, like I said, I just kinda worked out from home a
Mhm.
few during doing for a few years, just doing like workout videos. So that I did that for quite a few years. And honestly, I probably like cycled through just a couple like videos, but I knew that it was important.
Mhm.
It was important for my health. And so I stuck with it. And then my last year of med school, like some of my friends were like going to the gym lifting. So I went with them a couple times and I never thought it would develop like into what it is now, but it was just you just start off simply, with what you can, like, and what and I did get a coach for my
Mhm.
first few years and that, just like learn form and everything like that. And honestly, I've always kind of followed some sort of a program because doing things just kind of like sporadically on your own, not having a plan, is a little bit difficult. And that was really helpful. Honestly, probably had an online coach most of my years lifting that I didn't. And now, like for the past few years, thankfully, I've been able to have like in person, like, coaching where it's programming and they're just kind of there mostly just, looking on, like not necessarily personal training, but
Mhm.
where my gym is, I just kind of follow their programming and the coaches are there and stuff. And, honestly, you notice like the biggest difference when you do have somebody who's like telling you how much to lift and how much to push yourself because otherwise, you're not going to push yourself. So having some sort of guidance is definitely going to be very helpful. And you're really
Mhm.
going to, that's going to, they're going to push you more than you're going to push yourself. As much as you think, like, I like to think like I pushed myself, but no, when
Mhm.
I started working with somebody who was actually telling me like how much to lift and telling me like it's okay to lift heavy, like, yes, it's going to lift heavy, but you can, or it's going to feel heavy, but you can still lift it. Like, that really changed that, like, really changed the mentality too. Like, okay, like, this is heavy and it's going to feel heavy. It's not going to feel like it's coming off the ground for the first like 5 seconds, which is actually going to feel like a minute, but it'll come off. Just stick with it. And so
How
I
have
think,
you seen that that has helped you, like, even as a someone who is considered like in menopause? It's been like for now,
mm-hmm,
it's a couple of years that you've been, this
yes.
lifting is part of you. How would you say that it has
Mm-hmm.
benefited?
Yes. So I did. So shortly after my treatment, I did get a DEXA scan and I did have some
Mhm.
osteopenia in
Mm.
my
Right
lumbar.
at chemo?
Yep. Oh,
Mhm.
I did have some osteopenia. And so that kind of like was like really kind of like really pushed me like, oh no, like if I'm not going to be on hormones, like I really need to strength train. And so that's kind of, what really pushed me. And so I was able to reverse it, thankfully, through the strength
Yay!
training. Yeah. So that's kind of like my motivator is like, okay,
Mhm.
like, you need this for long-term health. And I think also being in medicine, you see a lot of sick people who just, maybe don't have the resources, weren't able to take care of themselves throughout their life, and it's such a difficult thing to watch them because they're essentially bedbound and can't
Mhm.
do very much for themselves. And when you see that, it's difficult, and you're like, I don't want to be like that when I get older. I want to live old, and I want to live. I don't want to just be bedbound or just relying on others. I want to be independent as well. That's a big thing too. So if I'm going to live long, I want to be able to do things and be active and not have to worry about fractures, and which is huge, especially for women.
Mhm.
Like 1 in 2 women will develop an osteoporotic fracture in their lifetime. And of those who develop a hip fracture, those can have significant mortality rates within the first
Wow.
year. And so, it's so important. I think is my personal journey, but also just kind of living it every day and seeing patients. And it's so like I just like I'm trying to like all my patients are like, okay, what do you do for strength training? Like, and it's like I'm always like starting like, okay, so like what are you doing right now? Like, and honestly,
Mhm.
like what I tell them is like, okay, like what's like one step that we can do? I will show them like modified push-ups and air squats like in the room. And when I'm like, if you're waiting for something in the microwave or on the stove, or you're waiting for your kids to do something, like see how many you can do in like a minute or whatever time you have, just throughout the day. But
Mhm.
it's like what's one thing that you can start doing? Is it just walking for 5 minutes after your meals?
Mhm.
What's one small actionable step? We're not going from like doing nothing to going to the gym 3 days a week, or 5 days a week. We are just going for what can we do that's easily accessible to you and that you're going to be able to stay consistent with. A lot of people like to change their whole lifestyle overnight, and that's kind of where we see a lot of things fall off. So what's one small step that we can do? And it's not going to be easy. You're not going to be motivated to do it, but we
Mhm.
can't rely on motivation. We can try to do things to prepare us for success. So just kind of knowing, okay, what am I going to do? Okay, am I going to walk 5 minutes today after lunch? Okay. And so what you're going to do, when you're going to do it. If you're planning on going to the gym, you're going to prepare, or work out in the morning, you're going to prepare your things from the day before. So you want to set yourself up for success as much as possible, because that's going to make it easy. Because once the decision is made of what you're going to wear, what you're going to eat, or, when you're going to do it, what you're going to do. Once those decisions are made, you don't have to rely on motivation. You don't have to think about it. You just go do
Just
it,
go and do
and,
it.
over time, you'll start to notice like the benefits in yourself. Like, like I'll have patients say like, I used to feel so tired. Like, I don't feel tired anymore. I actually have
Mhm.
energy. And, you start to notice these small things in yourself that really bring a lot of like, self-confidence. And for me, honestly, it's like the mental relief, the stress relief for me. Like, that's so big. Like, I always say, like, it's like a good thing for like the world that I work out, because otherwise I think I would be very mean.
Oh,
It's such a
no.
huge stress reliever for me. And it just, like all the dopamine release, it's so it makes me so happy. It's like you go in after work and it's like a long day,
Mhm.
and and I'm like, I don't want to be here. I would rather go home. But it's like, what am I gonna do if I'm gonna go home? I'm gonna go sit more and then I'm just going to be miserable. Like, now, let me just start off and see how I feel. And, there might be
You just do
times where
that
you,
like 5 minutes, like I'm just gonna,
yeah,
and then there you
exactly,
go.
exactly. It's like,
So I have
there,
a quick question, Dr. Ezra, before we get to one of my fun questions.
yes.
But what would you say, these, for those who are listening, this is a very powerful conversation with two doctors who are very passionate about menopause care.
Mm-hmm.
So, what would you like me to know about the care of someone who comes into my practice who might have gone through something similar, which is like, the premature ovarian insufficiency?
Mm-hmm.
What is something that you would like me to know about that person, not individualized, but just
Mm-hmm.
overall, for me to provide like the best care? What would you say for me to do? Ask her. What are some things that you
Yeah.
would love for me to ask that woman and
Mm-hmm.
be able to provide for her?
Yes, absolutely. So I think, there's so many things for, and, it's such, there's so many components to this.
Mm-hmm.
So number one, just making sure she's on the correct hormone replacement therapy. And that does include testosterone too. So for these women, we want, it's really replacement doses of hormones. So estrogen, progesterone, and testosterone. And really explaining to her why these things are important and why at such a young age, because with premature ovarian insufficiency, you have a 50% more increased risk of developing cardiovascular disease and dying from it, increased risk of dementia and osteoporosis. So that's pretty significant because,
Mhm.
women do have a significant risk of these things anyways. So that would be number one, just explaining the importance, educating of why she needs to be on these. And so, like, if something doesn't work, we can adjust. There's so many things that we can do to adjust, but it's just so important to be on these things. Number two
Mhm.
is lifestyle. I think a lot of people forget about lifestyle and what a significant impact that can have on you too. So we know that exercise, strength training, aerobic exercise, eating, like, anti-inflammatory foods and just whole foods in general, that's gonna really reduce your risk of a lot of different things, including heart disease, dementia, so many different medical conditions. And so we want to, and especially, like, with a decrease in estrogen, you have increased risk of insulin resistance and metabolic disease. And so, by doing these lifestyle things, you're going to improve your, chances of, not developing these things, and of course, stress reduction and sleep are also important too. So lifestyle is big. And then number three would be like psychological support too, because this is a big thing
Mhm.
that takes a toll on you. And it may not be at the time because you're dealing with getting through the treatment and whatever you have going on in life. And then it may not hit you right away. And I think today there's probably a lot more support, but you never know. You can't assume. And so just making sure, what mental support there is. You're essentially, all of your friends are complaining about having their periods. And it's just like, and like whenever I hear, honestly, even till this day, like, it's like, having a period, as annoying as it may be, like, that's typically a sign of health. And so, with that, be grateful that you have it and be grateful that you are not as even increased higher risk of developing cardiovascular disease, dementia, and osteoporosis. So, and then, there are girls who are in the same situation where, that not having a menstrual cycle is, you feel a little bit different from your peers,
Mhm.
and so that's, you're different. And so
Um,
that can be a big thing too. And obviously, fertility is going to be big because that, for a lot of girls, that can change everything. The plan that they had for themselves when they were younger is no longer
mhm.
not, or maybe not what they thought that their plan might look like. And there's a lot that can be done for today. And I was speaking with our friend, Dr. Erica Bovey, and she was saying, like, there's so many things that have changed just, over the years. And so there's never never say never, because there's so much that can be done. And with the research that there is now and everything that they're coming out with, there's always a chance. So it's never hurts to get reevaluated, even if you were told no before. It never hurts to get reevaluated because you just never know. And so just constantly making them aware that the door is always open, and to be open to getting reevaluated. So that's a big thing as well. And even support with other peers who might be going through the same thing too, because community
Mhm.
support is a big thing too. Having somebody else who's going through it or has gone through it, and you can talk to
Mhm.
them, that's a big thing because you feel less alone that way. And so I think those are kind of the big things that I would highlight and touch on. So
Those are wonderful, wonderful
yes.
Absolutely wonderful advice. And we can see why your patients are so lucky to have such a
Thank
wonderful
you.
doc. But, I'm not going to let you go without asking you one of
Yes.
So, what song would you say that part of life, that journey, what
Mhm.
song was just like, oh man, this was so me at that
Yes.
point?
Yeah, so this was a little bit difficult, and I kinda had to, like, think about this one.
Hmm.
But I think for me, that stage of life was it was, I didn't reflect on it until, like, honestly, the past couple of years. It's kind of when I actually had time to kind of reflect on things. And so
Hmm.
I feel like that was a big chapter of my life. And I'm very thankful for it, because without it, I would have probably never would have experienced like strength training. And that's like a big thing for me right now. And so I'm very, I became such a stronger person, and I learned to take care of myself better. And so I'm very grateful for just that journey, and what I've learned and how much stronger I've come out of it. And so that was, that's a chapter in not necessarily my past, but it's been quite some time. And so right now my journey is this, opening my practice and just continue
So,
to
what's
grow in
the
my personal
song?
self.
What's the
Y-
song? What's
Yeah,
the
so
song?
my
Because I'm
song,
not going to let you go
yes.
without.
So my song right now is going to
Mhm.
be "A Brave" by Sarah. And
Ooh.
so,
What part
yes,
of
because
that? Give me
geez,
a lyric. You don't have to sing,
I know.
but if you can sing,
So she says a lot, like, "Say what you wanna say," something about, like, let the world, like, hear your inner thoughts, and just, speak up.
Mhm.
And so that's kind of my journey right now, is
Yeah.
just, working on my presence in the community and educating women, and, eating lots of frogs and overcoming lots of fears, and being comfortable in in the discomfort, and, growing myself personally. So that's kind of, we're being very brave these days.
I'm going to be adding this song to our Menopause Story podcast
Nice.
playlist. It's going to be on Spotify. Yeah, absolutely. So
That's
there's so
awesome.
many of us who are going through these journeys, and to hear the songs that either we identify with at that time, or even the songs
Mhm.
we identify with now, like wow.
Yeah.
And so this song "Brave" is absolutely one of the songs that we're going to add to that playlist.
Yes.
So all the women,
Absolutely.
yeah, who want a little bit of upliftment, you can absolutely go to Spotify and look at the Menopause.
Yes. Oh, I can't wait.
Yeah,
That's
the
awesome.
Menopause
Well, this
Stories
can
podcast.
also, for women who are
Mhm.
going to their doctor's offices and maybe are nervous about bringing it up, speak up. This applies to you just as well. So say
Love it,
what
love
you want to
it.
say.
Say what you want to say. Absolutely. But with that, we're going to end today's episode of
Yes.
Menopause Stories podcast with Dr. Tamara Beckford. We had the wonderful honor of having my friend, Dr. Esra, who came on and told her story, her menopause story, which, was about how her journey going through this at a younger age and what she's learned, and about how she is now braver. I hope that for those who are listening, that this touched you, this motivated you, and this time that you spend with us is definitely something that we do not take for granted. We look
No.
forward to seeing you guys at the next episode of Menopause Stories Podcast with Dr. Tamara Beckford. And with that, we're going to say goodbye for now. You've been listening to the Menopause Stories Podcast. If today's conversation hit home, don't let your story stay stuck in that midlife hijack. Head over to the show notes to book your strategy session and to join the movement of women redefining their power. I'm Dr. Tamara Beckford. Stay optimized, stay bold, and I'll catch you on the next episode.